All right, guys. Good afternoon. Good afternoon. Good afternoon. Good afternoon, guys. Good afternoon. Good afternoon. Good afternoon. I hope everyone's doing well on this Friday afternoon, guys. I know it's crazy here in Dallas. We got wet weather. I'm so excited. We got some rain coming in here, but it's not cold yet. But it's damp. It feel like look like fall because it's been cloudy for the last couple of days. I just got back in town, so I've been out of town for 4 days. So I'm back. That's why my live is delayed to today, guys. So I'm excited. So I get ready to go for this live. So welcome to Travel Coordinator for Families with Disability. Today's topic will be about health and safety considerations. We're going to discuss managing medical needs while traveling, including medication, storage, and emergency contacts. Preparing for emergencies, such as finding accessible medical facilities aboard, and travel insurance options that cover disability specific needs. So we will go over that. I sent it to y'all on Monday. So y'all should have got all that information on Monday. I sent to y'all what we're going to discuss on today. Okay, so let's get started. There's a lot of information I need to talk about today. First, I'm going to talk about the preparing for accessible medical facilities aboard is a smart strategy, especially for groups traveling involving families with disability. Here are some tips to help ensure your comprehension of preparation. Number one, we're going to talk about research hospitals and clinics. You want to identify nearby hospitals and clinics in each travel destination, specific noting which ones offer accessibility facilities and disability friendly services. That's a must. Many major medical centers aboard have departments specific for international patients. So, guys, so when you research and you're in a travel, this is this is important that we find research hospitals and clinics in the area that we are traveling to. It is a must, guys. Okay, this is very important. So we cannot forget this important. I know we all get excited to travel, but we cannot forget about your health. What's going on with your health? We got to make sure that these places are there so we can get to in case of an emergency. Number two, we're going to talk about is coordinating with local experts. Partnering with local travel agencies like me, medical tourism companies, or even ambassador contacts who knows the accessibility options within the area can provide timeless assistance. Yes, you want to find people can help us. It's good that we can research. Yes, we can get on this website and look at books or whatever, or find things. And but if you know people that can help you, contact them. Let them know that hey, I'm going to make a trip. I got a group trip that I'm about to take, and guess what? I need help. Give me some information. This information I have. Can you give me what you have so we can make this as a teamwork? Yeah. Number three, we're going to comply emergency contact lists. Include the contact information for hospitals, ambulance services, accessibility support organization in each area. Having this information ready, accessible, is crucial in case of emergencies. Yes, we need to have everybody we need to contact. Contact A, contact B, contact C. If we can get in contact with A, we got contact B. We can't get with contact B, we got contact C, guys. So we got to definitely keep these contact lists people involved, especially for hospitals, people, ambulance. All this need to be in our contact list. We could be able to hit that button, dial. Okay. Number four, accessible transportation options. Of course, we need options for this. Ensure emergency transportation options can accommodate mobility devices or other specialized equipment. Contact local transportation companies to verify accessible vehicles availability. Yes, we definitely need to do that. We're gonna do that from the beginning. If we're taking a group with people we need all wheelchairs, we definitely got to find somewhere we can take all wheelchairs. Okay, number 5, prepare health documents. This is important. Keep medical records, prescriptions, and accessibility requirements in a digital form. Securely save the easiness accessibility. A translator of keys document into a local language can also be helpful. Now we know we're going somewhere out of the country or in the state. We want to make sure that the language barrier they can understand us as if they can't speak English. We want to make sure we can translate it quick to them in their language. That's a good thing. Digital form. That's when you make a copy, put it in digital form in case you lose the paper or your luggage get lost. We have it on our phones. So therefore, when we get to somewhere, we get sick, we need a copy of your medication descriptions. We have that right here. So we want to make sure that we have that on our phone. That's important. We want to make a copy. Scan everything to your phone. If you want to scan, you can scan it. You put it on your phone. Email. You can email to yourself. Documentation when we have copies, extra copies, 2, 3 copies in case. Send it to somebody else in case you lose your phone. Okay? So we want to make sure that all that is there before we leave. Prepare health documents. That's important. Number 6, insurance coverage. Ensure all travelers have accomplished health insurance that includes coverage for medical evacuation if necessary. Or yes, we want to make sure if we have any insurance coverage, they're going to include evacuations because this is important for us to get us out of there because we have a lot of people that have disability, handicap situations. We want to make sure we don't want to be the last group to get out of there. We want to be the first group to get out of there because guess what? We have our shit together. We have our insurance. We'll make sure that, hey, I'm calling you, baby. I need you to be here on time. Or if it's a hurricane come or a tornado come, I need you to get me out of this state. I need to get me out here immediately. A flood is coming. Up, they say a forecast flood coming in 2 days. We need to evacuate the city. I need to be out here. I need you to be on time. Insurance is important, baby. You got insurance people to talk to you. If you don't have insurance, they're gonna lag and take the time to get you out of there. They're gonna use volunteers. So guess what? We need insurance, baby, because insurance is gonna talk. Okay, thank you. So number 7, create a response plan. Outline an emergency protocol for the group. Include designated contact, meeting points, step-by-step action, and events of medical crisis. Of course, we're going to do that. That's an automatic must. Baby, who? We got to do that, guys. We got to do that. That's a must. So that's my 7 steps for helping your insurance company preparation for your medical facilities, guys. They are number 1, research hospitals and clinic. Number 2, coordinated with local experts. Number 3, complying with emergency contact lists. Number 4, accessible transportation option. Number 5, prepare health documents. Number 6, insurance coverage. Number 7, create a response plan. We definitely. Oh, something else I want to talk about. I made concept. Okay, coordinated with local. I want also in this thing. I did talk about insurance. I want to make sure. Oh, establish like medical emergency protocol for the group. Um, on here, this is some extra information. Uh, meeting points. I didn't say you want to identify easier access to meeting points within each of the destination where groups members can gather if separated. Yes, that is a definite. So in a protocol, you want to make sure we have meeting points so they can know when we get to these places, hey, this is going to be a meeting point right here if somebody get lost. Hey, this is going to be a place somebody can meet right here if we get lost. Hey, here go right here. This red brick building, this green building, this purple building. So we're going to make sure we have territories that we can know that these are protocols in case an emergency happen, evacuation happen. Hey, you're going to be with a group leader, so therefore we have these places that we're going to meet up at if we're not all together. So I know I want to, so that's what I want to. And then like for emergency response steps, you want to step 1, contact the designated emergency lead. Number 2, call the near accessible medical facility. Number 3, you want to use establishment transport for accessible need. Number 4, ensure that all medical records and documents are accessible. So yeah, so I marked that for to make sure that we have protocol destinations that we can meet up in case we get lost. That was a must. So that's the 7 steps for ensuring medical facilities aboard, smart strategy, traveling in case we get somewhere, we go somewhere, we know places that we can call, safety. This is great information, guys. Keep that in mind. So next thing I want to talk about is insurance. Let's go. Here are some travel insurance options and features that can help coverage disability specific needs for our clients. These options focus on comprehensive medical care, emergency assistance, and accessible travel support. Number 1, specialized disability travel insurance providers. Here goes something they're going to give you. Analyze Global Assistance. We know about them. Then we have the World NORMADs, and we have the AXA Assistant USA. With the World NORMADs is offer flexible policy that cater to medical conditions, emergencies. If covers lost medical aid, emergency medical transport, or more. So you will call these people in case we need to get coverage. Because if you know, if you like you say, if you lose anything dealing with mobile aids, anything that dealing with your devices, we want to make sure we have that kind of insurance coverage, extra coverage on our things, especially like hearing aids. Most likely, hearing aids should not fall out, but if you have something that is not inside of your ear, have surgery with, yes. If you're using these mobile devices so you can hear, yes, we want to make sure we have insurance on all that. Um, Even on your wheelchair, mobile wheelchairs, we want to have extra insurance just in case it breaks, so we can get it fixed. You can get it fixed and get it back home. So you just want to make sure you have analyze. We know about analyze. They medical coverage, trip interruption assistance with finding accessible medical facilities. You want to use them because in case of a hospital, we might need to find out if we're going overseas somewhere or in the Caribbean. Is this hospital can take my insurance? If not, we need to get some insurance with Allies because they can do other options outside of our um, healthcare uh, um, companies. So we want to look for other companies that can take care outside of if your network cannot go overseas or in the Caribbean, you want to find other options to get insurance from. Like I always tell people, people say, I don't want insurance. No, baby, no, you want insurance. You never know what's going to happen. I don't care just for me or for somebody with disability. Go ahead and get it. Pay a little extra $40 to $50, whatever, how much you want to be, and be happy and go be merry because you need it. You don't know what's going to happen. Especially if you're bringing children. If you're bringing children, you don't know what's going to happen. They might hurt themselves, fall, or anything can happen, even you. So just go ahead and get it. If your coverage cannot, if your healthcare information cannot coverage your stuff overseas or in the Caribbean or where you're going, they have other options you can buy from. Number 2, comprehensive medical coverage. You want a medical evacuation. You want to ensure that insurance cover emergency evacuation that can accommodate wheelchairs or mobile aid, of course. Pre-existing conditions. Look for providers like 7 Corners that offer ways, options, cover pre-existing conditions as long as the policy is purchased within specific time window after booking. Yes, with this one, you got to look for the window. Go ahead, purchase it. When I say it's okay, it's time to purchase your insurance. You go ahead because they give you a deadline. They don't prolong it to the time you go to the trip. No, ma'am. They give you a window. And within that window, you need to book it. Then within that window, so have your coins ready. If you know you want to get insurance, so keep them coins to the side to purchase it because they're not going to allow you to purchase it at the same time for the trip as we go for the trip. Okay. Number 3, mobility assistance equipment coverage. Okay, lost or damaged equipment. Some policy covers the replacement or repair as mobility aid like wheelchairs, scooters, and prosthetic devices. So we're going to make sure. And then rental reimbursements. Certain policy include reimbursements for rental mobility aids while aboard if client-owned equipment is lost or damaged. Yes. So you got to think about all this. When we booking these stuff, we got to look for all this good stuff, guys. Then you have 24/7 travel assistance service, accessibility accommodations, transport assistance. Look for providers that offer concierge service to help local accessible hotels, medical services, and transport in emergencies. Yes, we're going to look for all this. Can give us more information to help us to book and find hotels, all that good stuff, guys. Yes, you want to find somebody to do inter interphrase services. Somebody who speak. You want to find so in case of some policy includes interruptions for medical needs, which can be critical in navigating healthcare aboard. So you're gonna look for this services as well. So yeah. So number 5, accessible and inclusive policy terms, customizing coverage. Companies like Travel Insurance International, Travel X offer policy that allow for specific disability-related needs, ensuring clients get coverage suited to their unique requirements. Yes, you want to make sure accessible and inclusive policy terms. You want to make sure you find companies that going to make sure give you your full needs of everything. Yes, so all that's good, guys. So within this is information about insurance, travel insurance. This will help you to get more coverage. If you don't have that, if you have minimum coverage, you need more. This will help. If you don't have none, this will get you. Because especially if you go out of the country or going to the Caribbeans, this is going to help you, give you a little relief on traveling, especially when you have a disability. Because I know a lot of people, things might happen to your machines, things might get broken. You just want to have insurance so they can reimburse you for in case something happened in that wherever you're at, so you can get money back to fix it, to help fix it. Because I know most of y'all are on budget. Some of y'all are on budget. Some of y'all not working. Some of y'all getting this funding from the state. That's it. So we want to make sure that that you get coverage. Period. Okay. So that's for the insurance part. Okay. So now we're going to talk about managing medical needs during traveling. Okay. So here we go. This is only 4 things that you need to do. Manage your medical needs during traveling. It's like for your medication, storing medication, stuff like that. Emergency contact is essence. So these things that you need to do when you're traveling with medication storage. You want to organize by traveler. Ensure each traveler medication is clearly labeled with their name, doses, instructions, and times. If traveling with a group, you may want to provide medication organizers or Ziploc bags that are easy to transport and label. Of course, you want to make sure you put tape on something that's not hard not to label. You want to use a marker or just name your medication, how many times you got to take it a day, put it on that thing. Or you take it on certain days, Monday, Wednesday, Friday, or Tuesday, Thursdays. You want to make sure you have that label on there, let everybody know what days you take this. So you want to make sure it's clear and understandable for the next person who can get to consider refrigeration needs. Some medication require refrigeration. Contact your accommodation in advance to request access to a mini fridge or bring portable coolers if necessary. Yes, we want to make sure that if we're going to a hotel, make sure that they have a refrigerator because we have medication. If not, we got to bring a cooler. We got to bring a mini cooler to keep your medication cooled. We got to do the old school way. Put some ice in there, put it in there, put some, keep it cool. Buy those what kind of ice thing they call them? Ices, that froze ice, whatever kind of ice it is, right, to keep yourself cool. We gotta do what we gotta do. Okay, you do want to store it in carry-ons. Keep essential medication in a carry-on or personal item rather than check luggage to avoid loss or delay. This is especially important for time-sensitive medication. Of course, God, this is so important because a lot of people, when I was a flight attendant, a lot of people had medication. Oh, my medication is on the plane. Why it's gonna be on the plane? You know you gotta take it within a couple hours. If you know you're going to an airport and your flight, you leave a flight, your flight due is at 10. You get to the airport by 8. And you got to take your medication by 11. So that means you're gonna be in the air, get to your destination. So your medication need to be on you. Now, if you have extra stuff, put it at the bottom, of course. But the ones you need to take need to be on you in your carry-on. Have it labeled, Ziploc, so TSA can see it. You want to make sure you want to have it hidden like it's drugs, or you're trying to get through. You want to make sure that it's labeled. Ziploc bag, medication. They can see it. Even your bottles, it's labeled. So don't overwhelm yourself and pack yourself under the plane, and you know that you need to take medication while you're on the plane. We don't need you to get sick, baby. We don't even have an emergency landing. Okay? So make sure you have your medication on your carry-on. Okay? Carry-on. Carry-on. Especially if you need medication to keep you calm and collected, we in the carry-on, not under the plane. Because baby, I will have to tell people, we need to get this plane on the ground, baby. Get your medication because we need you acting the fool. Okay? So that next is documentation under medical storage. Have copies of each travel prescriptions and, if possible, a doctor note explaining the necessity of the medication to avoid issues at the airport security. Here we go again. Documentation, label. Everything your medication label in a Ziploc bag, label. And everything have a label on it is legit. Documentation, just in case they want to see a doctor note saying, hey, you got to take all this medication. Because some TSA are going to look like, damn, you got like 20 bottles in here, you got to take all this medication a day. They're going to want to see documentation, verification from the doctor, a note. And make sure when he signs, sign legible, and make sure you want to get it notarized. Just keep you safe, get it notarized, get a stamp on it. That because a lot of prescriptions now, people's signatures don't look like it's real. So we got to make sure that your source is legit for you to travel safely with a smooth traveling with no headaches at the beginning. We want to make sure everybody's happy at the beginning, no headaches. Okay. Documentation, we need it if necessary. Number 2, we're going to talk about the emergency contact information. Once again, create a contact list. We're going to get the emergency contact information for each traveler. This should include their primary emergency contact, their health care provider information, and specific instructions for emergency. That's common sense. We all want a list of everybody we need to get in contact with. Doctor's name, facility where you go to. Just have it. Just do it. If you don't want to do it, just do it anyway. Okay. Assist role for group trips. Yes. Designate a health coordinator or point person who knows where all medical records and contacts are stored. This person should be trained on what to do if someone is in the group needs emergency immediately help. Sorry, guys. Now we can't have this person on a trip that they in discharge with emergency information. We're gonna say, hey, Laura, give me Allison emergency contact list. The one she got. What doctor she need to go to? What's her doctor's name and what facility we need to go to for her? I mean, yes, but if you do this, you might have to pay for this person, just an extra person on the trip. So we want to make sure that, it's good just in case this person can be on a trip, have everybody contact information. I mean, this can keep a headache. So everybody don't have to worry about having everybody contact information. Just give it to one person. Maybe it's great to have, but I prefer to have information myself, just to make me feel good. Visit one person having it, I don't know, she might forget it or whatever. So I want to make sure that more than one person have it. Okay. Then we're gonna then we're gonna store digital and physical. Like I say, make copies of it, put it in your phone, so we can all have it in case you lose the paperwork, or in case we go somewhere that we have is your phone. Okay, so we want to make sure just make copies of everything we need to make a copy of. Okay, number 3, emergency procedures and backups. We want to local um, medical facilities before departing. Research nearby hospitals, clinics, pharmacies at your destination. Yes, we want to think about all this. Ensure you're prepared if a group member needs quick medical attention. Yes. Translate key medical information. If you're traveling aboard, translating essential information can each personal medical needs and medication into the local language. Yes. Just help with communication if you need medical assistance. Yes, ma'am. You'll want this. If we're going somewhere that speak French, Spanish, Chinese, Philippine, any kind of language, we want to make sure that we can be able to translate to them. They can read it as well to help us. Brief the group. We want to hold a short orientation at the start of the trip to make sure everyone understands what to do in the case of emergency, include whom to contact and where important health information is stored. Exactly. And number 4, last but not least, regular health check-ins. Check in daily with travelers, especially those with ongoing medical needs, to ensure they are keeping up with their health routines, addressing any new issues that arise. For a larger group, consider using the health checklist for consistency. Yes, of course, when we have a group, guys, we want to check up on them every day. You're gonna be with them every day. You want to make sure how you feeling, how you doing, you okay? Are you taking the meds? Do you need anything? Do you need any assistance? How you feel okay? You feel okay to do this excursion today? Do you want to sit out for the excursion today? We got to be consideration of their health as well, guys. We have to be consideration. They might be excited, but we got to make sure we making sure they are healthy during the time while we are traveling. They might can't see you. They're not feeling good, but you got to look at their reaction of their face. You got to pay attention to them. They can't talk to you. You got to look at their reaction, how they responding to you. So we got to be consideration of how they feeling always, all times, all day. Okay. So yeah, so that is my for storing medication, emergency checklist, all that good stuff, and procedures, what you do to back up, health check up. I mean, all this is great information, guys. If you're doing a trip coming up soon, please keep some of this in consideration so you won't forget, especially medication. You want to store medication or bring medication. You want to make sure you put it in the carry-on, not in the big luggage going under the plane. That's very important because a lot of people do leave their medicine in their big luggage under the plane. I experienced before. I know what people do on the plane. So guess what? This is important. So please keep that in mind. Okay, guys? Keep that in mind. So yes, so that is my live for today, guys, on family exclusive live number 9 for today, guys. Once again, I apologize for a late delay this week. My plans, like I always say, if I can't do it on Wednesday, I'm gonna do it this week. Like I say, I'm always do my live. If my live is supposed to be on Wednesday, that's my time at 12 noon. But today was option because I was out of town Wednesday. So if you have any questions, any concerns, if you want to talk about any issues, let me know. We can have a discussion on that in the group, guys. So hey, that is it for my live for live number 9 on health and safety considerations for this week, guys. I'm getting prepared for next week. Next week should be okay. Um, Wednesday live is next Wednesday should be okay. Sunday is the 10th. Monday is the 11th. Tuesday is the 12th. Wednesday 13th. Okay. I think everything should be great for Wednesday at 12 noon. Okay. All right, guys. So I'll talk to y'all later. Like I always say before I get off my live, don't allow the devil to steal your joy. I don't care who it is. Okay. Be blessed. Stay safe. In this world today, guys, it's gonna be the next 4 years gonna be rough. So we need to stay prayed up and make sure that you keep going, keep doing what you're supposed to do. Don't let the devil steal your joy, and don't let nobody else take you from what you're supposed to be doing. Okay, stay prayed up. I will talk to y'all on next Wednesday on live number 10. Good day. Have a good day, guys. Be blessed. Bye. All right, Facebook. All right, YouTube.